The new COVID vaccines use a different technology to combat COVID-19, different than others developed over the years. Joining us to shed light on some of this is Dr. Samuel Pope, Medical Director of the ICU at Hartford Hospital. Doctor, welcome.
Thank you for having me.
So this vaccine utilizes messenger RNA. We've heard a lot about this. What sets this vaccine apart and why is it so effective?
So we've used messenger RNA actually for almost 30 years to tell mammals to produce protein in research studies, and we started to use this in people back during SARS and MERS. But this vaccine is the first time we'll deploy it widespread. But we can basically tell your body to make a small piece that's not infectious, not alive, of the virus itself, called the spike protein, and then your body will in turn make a great deal of antibodies against that.
Amazing. Okay, could this method be used to combat other viruses in the future?
And not just viruses. So I am absolutely certain there will be some vaccinations that we take in the future that will use this technique, but also other disease states where we need to tell the body to produce a certain antibody or a protein.
And Dr. Pope, what makes you so confident in the vaccine's safety? And what would you say to people who might be skeptical or scared?
Yeah, it's very similar to what happens to you if you catch COVID, in that you only will create antibodies against this small piece of the coronavirus. It happens to be the most important part that allows the virus to get into your respiratory cells. And so there really should not be any side effect that's different from your own immune reaction to the virus itself. Not the cytokine storm or these lingering effects we've heard about, but only the antibodies you create. And so other than just the local reaction, like your arm hurting for a day or two or some low-grade fever or muscle aches that are common with all vaccines, there really doesn't look like there's much else with this vaccine that's different.
Okay, from the first wave, we've seen the COVID mortality rate decline. Why do you think that is?
So we are doing a much better job with our treatment. So we have completely shifted our focus away from early intubation, mechanical ventilation. We're using a lot more high flow oxygen, and just the way that we're treating this is very different from the way we've treated viruses and viral pneumonias in the past. We also have effective medicines now. They're not perfect, and the vaccine is hopefully going to seal the deal on this forever, but these medicines we have work. And we also right now are seeing a slightly younger clientele. Instead of nursing home patients, we're actually seeing a lot of our patients are catching this in small group gatherings with their family and friends. And so it's a little bit younger group of people.
All right, doctor, real quick, 20 seconds. It's an exciting time historically. As a frontline worker, tell us your thoughts on what we're seeing right now with the vaccine.
So I have seen way too much at this point, and I am ready to not see it anymore. And I think this is truly historic as a human race. This is something we're going to do that we've never done as a species, and I can't wait. I'm very excited.
All right, Dr. Samuel Pope, thank you so much. Great information, great explanation. Thanks.
Thank you.